resume the recording. Can I get a thumbs up if everyone can see my screen? Thank you so much. Well, good morning to everyone. My name is Richard Price, and I'm staff liaison for AASHTO's Council on Public Transportation and the Multi-State Transit Technical Assistance Program. And I want to welcome you to today's online forum. But first, before we get started, as always, I'd like to thank AASHTO's premier and capital sponsors. Our premier sponsors are AECOM, Bentley, HNTB, Jacobs, and WSP, as well as our capital sponsors are Amazon, American Concrete Pipe Association, Autodesk, and HDR. We always like to thank those who provide us funding and to help us keep these programs going. Next, before we get started, I just want to go through a few housekeeping items. Everyone showed up on this webinar with your mics muted, so please keep yourself muted. Please, to preserve our bandwidth and my internet connection, please keep your video off unless you're talking or a speaker. As I just said, we are recording this session, and we will post the recording as well as all the documents, PowerPoints that are with this, all with the presentations, all online after today. Now, one of the reasons we use Zoom is for the chat function. I know people love to chat, so please, if you want to chat with any of the panelists, any of your colleagues, please do so. If you want to chat with me, because if you're experiencing a difficulty, let me know. So there's something perhaps I can do to resolve it. But I want everyone to start with a first chat. Everyone gets one chat at least. And let's start with our virtual roll call. So please send me in the chat your name, your title, and your organization. And if you have a contact information, because I don't really have it on file, please send that to me as well. But let's have everybody use the chat and send me that information to get us started. Now, without further ado, I'm going to turn it over to our moderator, Secretary Roger Millar of Washington State DOT. He is chair of the Council on Public Transportation. Roger, the floor is yours.
Thank you, and good morning, everybody, from Olympia, Washington, where it's sunny and it's going to be 70 degrees today. And I'm going to celebrate that by staying indoors on Zoom meetings all day long. This one is going to be great. I'm looking forward to the topic area. We're going to talk about states coordinating transit access for COVID-19 vaccinations. It's just another thing that the states are doing and transit agencies around the country are doing in response to the pandemic. Just after the pandemic began, the transit industry made an overnight transformation. We went from an agency, an industry that delivers people to goods and services to an agency that more and more was delivering goods and services to people. That was a major pivot to the traditional transit business model, from primary mobility to meal and medicine delivery. And we were doing that while we were still doing our primary function of getting essential workers to work and home from work. So transit agencies kept people safe and healthy and fed last year. In some cases, we were providing some of the only at-home care available to those in our communities with few or no other options. So now, as vaccine distribution moves forward, many agencies are again pivoting to make access to vaccination sites and access to vaccination appointments a top priority. The transit industry has done a remarkable job to expand access to the vaccines in the face of rigorous yet necessary health and safety measures, particularly for people with limited or no means of mobility. Just as they did at the onset of the pandemic, our nation's public transportation leaders are demonstrating creativity and flexibility as they work to provide solutions for the communities they serve. Now, in Washington State, we've been quite busy in this space. Across our state, we've seen a real uptick in the number of agencies offering free transit rides to vaccination sites and appointments. In our larger urban areas, Sound Transit, King County Metro, Pierce Transit, the Spokane Transit Authority are all offering free access to vaccination sites and vaccination appointments. Our rural and smaller transit agencies, including Ben Franklin Transit, Twin Transit, Kitsap Transit, to name just a few, have similar programs, and our nonprofit agencies and other partners like People for People and HopeLink that do specialized transportation are doing much the same. So I'm happy to report that our governor broadened vaccine eligibility to all transit workers here in Washington state, along with other critical frontline workers very, very early in the vaccination timeline. And so we were able to get transit workers who wanted a vaccine vaccinated. As of today, vaccines are available to everybody in Washington state over the age of 16. But we got our critical workers right up there at the front of the line. And that was, again, at the governor's direction, at the request of myself and others in the public transportation industry. So a lot happening in Washington state, and I'm sure my colleagues around the country could tell similar stories of how public transportation and our state DOTs have really stepped up in the face of and in response to the pandemic. So now I'd like to introduce our very special guest. We're going to hear from Henrika Buchanan, the Associate Administrator for Transit Safety and Oversight and the Chief Safety Officer at the Federal Transit Administration in Washington, D.C. She has over 20 years of experience in administering federal transit programs, transit safety, and compliance. The FTA Office of Transit Safety and Oversight administers a national transit safety program and monitors program compliance to ensure safe, reliable, and equitable transit service in accordance with FTA policy and regulatory requirements. The office implements and oversees safety standards for all modes of public transit in the United States. In this role, she is leading FTA's COVID-19 recovery efforts, which include implementing the federal mask requirement for public transportation and effectively extending the compliance deadline for the Public Transportation Agency Safety Plan, or PTASP regulation. She's also responsible for the programmatic oversight of more than $69 billion in supplemental funding allocated to the transit industry for COVID-19 response and recovery. Additionally, her office provides programmatic oversight of more than $11 billion in transit investments every year. A native of Hillsborough, Alabama, Henrika received her BA in political science and a master's in urban and regional planning from Alabama A&M University. She received her law degree from the Georgetown University Law Center. So Henrika, please turn on your microphone and camera. The floor is yours. Welcome.
Hi, welcome. Thank you, Roger. Hello, everyone. I'm Henrika Buchanan, FTA's Associate Administrator for the Office of Transit Safety and Oversight and Chief Safety Officer. Many of you know me from my previous roles in FTA. It's really good to be here again with the state DOTs, because if you've been around and you know, I saw a few familiar faces, and I was telling you, I actually saw quite a bit of new faces, which is just lets me know I've been out of the program management space for quite a while. But the state DOTs is a group that I know well, and that, you know, really close to my heart in terms of making sure that as we do federal programs, that we do it with you and ease of implementation in mind. So thank you for inviting me to take a part in this important discussion today. I'll share a few details on FTA's response to the COVID-19 pandemic. So next slide, please. FTA adopted 4 primary approaches to help transit respond to and recover from COVID-19, providing proactive technical assistance, facilitating the acquisition of PPE and other critical resources to mitigate COVID-19 within the transit systems, providing relief from administrative and regulatory requirements, and of course, providing funding that systems needed to continue to operate, to continue to keep people employed, and to invest in the supplies and cleaning practices and maintenance to help them recover from COVID-19. So I'll start off with funding. The federal funding administered by FTA to support public transportation and our recovery from COVID-19 is unprecedented. So next slide. In addition to the approximately $12 billion authorized annually under the FAST Act, we received an additional $70 billion that's been appropriated by Congress to support public transit through the CARES Act, CRISA, and the American Rescue Plan. So FTA will continue to shepherd these funds quickly, responsibly and equitably, and ensure that safety remains the highest priority as we continue to work with our transit partners. Next slide. With respect to technical assistance, FDA's focus is on supporting implementation of the federal mask requirement and ensuring transit workers have vaccine access. As many of you are aware, President Biden issued an executive order to save lives by mandating on all public forms of transportation that masks be worn, including public transit. FDA's response to the mask requirement has been to provide resources, guidance, and technical assistance to you, our transit agency stakeholders, and industry partners. In February, FTA Deputy Administrator Nuria Fernandez hosted weekly stakeholder calls to cover what the mask requirement means to public transportation agencies and to discuss challenges and best practices. In all, we had nearly 2,900 participants in a 4-week span. So you can see how important this topic is to our transit community and to us at the FTA. In addition, we funded some additional offerings of an NTI course on operator assault, and we quickly realized that we couldn't provide enough offerings of that talked about de-escalation practices. And so we were able to do 13 offerings, but we also made it a plug and play online resource. And we've had over 2,000 individuals take that online version of the course since we've developed it. So we brought our partners together, TSA, CDC. We created a space for the transit industry to be able to ask their questions and get the guidance needed. And in follow up to that, we've made sure that we did provide some training on things like de-escalation, because we didn't want to put transit operators in the position of having to police this requirement. So on the next slide, you'll find links to FTA's Mask Up page, to all outreach recordings and transcripts on our Mask Up page. Finally, one thing we heard from our transit industry stakeholders through these outreach events is that they needed resources to help inform and promote the mask requirement in their communities. So in March, we worked with our modal partners at the USDOT and launched a Mask Up campaign that includes a holistic digital toolkit filled with posters, social media graphics, and FAQs transit agencies can use to help educate passengers as they travel on public transportation. So next slide. To support President Biden's call to improve access to vaccines, FTA hosted a national peer exchange on vaccine access on March 26. And this event highlighted how transit agencies are working to provide vaccine access to their workers and throughout their communities. It was led by Deputy Administrator Fernandez. Participants included the Federal Emergency Management Agency, the National League of Cities, transit agency representatives from Brazos, Texas, a transit district, from Foothill Transit in Covina, California, MARTA in metropolitan Atlanta, and the Utah Transit Authority in Salt Lake City. So FTA also published guidance clarifying that transit agencies may use transit vehicles to provide transportation to and from COVID-19 vaccination sites. We've highlighted that transit agencies may use transit facilities and vehicles as vaccination sites as eligible incidental uses, as long as it doesn't interfere with the provision of their transportation service. As vaccination distribution continues across the country, we've seen so many partnerships between transit and public health agencies and transit and communities. You all are really doing a fantastic job of using the resources that we have to help meet those local needs. And we've been trying to highlight those stories as we learn of them. But again, just to sort of emphasize what Roger said earlier, a transit has gone from taking people to the jobs and to the locations they need to go to also taking those services to people. And we're pleased to see that. And we've tried to create the space and the guidance that allowed systems to do what needs to be done to help their community address COVID-19. So the next slide. So to continue the conversation started by Deputy Administrator Fernandez on March 26, Each FTA regional office will be hosting conversations in April with federal, state, and local partners in their region about transit's role in supporting equitable vaccine distribution and access for transit workers and their communities. And in fact, 4 of those regional exchanges happened this week. I think the last 2 are happening today, but region 1, 2, 8, and 9 have had their events this week. And then we do have additional offerings that will be happening over the next week. Next slide. So sharing information on transit's COVID-19 recovery efforts, implementation of the mask requirement, and vaccine access efforts has never been more important than now. This month, we are starting a new mandatory reporting for the Transit COVID-19 Recovery Program. FTA will use the information reported to inform the actions and strategies in support of the transit industry's COVID-19 recovery efforts and implementation of the federal mask requirement for public transportation. Each month, FTA recipients will be reporting on 11 data points with information on transit workforce counts, service impacts, and transit worker positive fatalities and recoveries. The first report is due tomorrow, April 16th. We held 4 training webinars in March to ensure that FTA respondents understand the report and how to report. You can go to FTA COVID-19 information collection webpage or email FTA systemsafety@dot.gov for any questions. So next slide. Finally, this has been a challenging year, but I'm feeling more optimistic thanks to the focus on the vaccination rollout and all the great efforts that transit is making in communities across the country. President Biden announced in Pittsburgh his plan for major investment in infrastructure, the American Jobs Plan, which would invest $2 trillion to transform infrastructure, including modernizing tens of thousands of highways, roads, and main streets, installing 500,000 electric vehicle charging stations, investing billions in our airports and ports. And let me particularly highlight this part, which would be doubling federal funding for transit. So let's try the next slide. The latest estimates for USDOT indicate a transit repair backlog of $105 billion. That's billion. The backlog represents more than 24,000 buses, 5,000 rail cars, 200 stations, and thousands of miles of track, signals, and power systems, all needing to be replaced to improve safety, reliable service. When ridership becomes back after the pandemic, you and other leaders in the public transit industry will need to right size and modernize our systems to meet rider demand. And I'm hopeful that we will have the resources necessary to make those investments. So thank you for this opportunity. I'm happy to answer any questions at this time.
Thanks, Enrica, for your remarks. Now we're going to get into the Q&A. In advance of today's session, we solicited some questions from members and collected a bunch of good ones. So our first question is from MTAP Steering Committee member, Mississippi DOT's Shirley Wilson. Shirley asks, what FTA resources are available to state DOTs to support vaccine access and distribution?
So first, let me say hi, Shirley, because you know Mississippi. She's been around a long time. I'm actually an Alabama native, and so I've met Shirley many times. So thank you for that question. First, you know, FTA formula and supplemental funds under the CARES Act, CRISA, and the American Rescue Plan are available for state FTA recipients to set up and operate vaccination sites at transit facilities and to support transportation services to and from COVID-19 vaccination sites as an incidental use. And we've actually said that the cost of operating those type of services using transit assets and at transit facilities was also an eligible expense under the supplemental funding. So we've published a series of FAQs on FTA funding programs that can be used to support these activities. In addition, we do have several resources available to support state DOT recipients regarding vaccine access and distribution. So again, we hosted a national peer exchange on March 26th on transit's role in COVID-19 vaccination, focusing on how transit agencies are working to provide vaccine access to transit workers and communities. The event materials, including the slides, recording, and the transcript, are available on FTA's website. And those materials provide some great examples of how you may partner with local entities to support vaccination efforts for transit workers and your community. In addition, we've published a COVID-19 resource tool for public transportation, which is a one-stop shop for federal COVID-19 guidance and recommendation. So this tool includes a section on vaccination planning for state and local agencies, and it's updated weekly. And in addition, we have the COVID-19 Recovery Practices in Transit Toolkit, which provides links to practices implemented by transit systems in response to COVID-19. Practices are organized under key categories, and information is provided on how transit agencies are supporting vaccine access and distribution. So not only are the funds and the transit assets available that you've received under the CARES Act, under CRISA, under the American Rescue Plan, but we also have these online resources that really highlight some of the best practices that we see going out on the many different practices. Because, you know, all like they used to say, if you see one transit system, you see one transit system, and really one community's needs is just one community's needs. So based on the needs of that community, we've tried to allow the flexibility for transit to really step up and be a player in terms of allowing using their assets and their resources to help their areas recover.
That's great. There are a lot of resources available. Our second question is from MTAP's immediate past chair, New Mexico DOT's Dave Harris. Dave asks, with the deadline for enforcement quickly approaching, is FTA considering extending the PTASP Notice of Enforcement Discretion deadline beyond July 21, 2021?
Well, I have to say hello to Dave too. That's another familiar name and familiar face. So hi, Dave. I am happy to report that as of April 12th, we've received certifications in trams covering 647 of the 705, or 92% of the applicable transit providers under the PTASP regulation. So that leaves only 58 systems remaining. And in fact, 43 out of the 50 states, or 86%, that are required to certify on behalf of the small public transit providers and subrecipients have also done so. So we are encouraged by the progress that we see on the issue. So we are continuing to offer extensive support through our PTASP Technical Assistance Center for the remaining 58 transit providers to help them get across the finish line. And so we're not taking our foot off the gas in terms of making sure that the resources and technical assistance that is needed is available for systems. And we're tracking this on a weekly basis. So although we will continue to evaluate the impacts of the pandemic on transit, at this time, we don't have any immediate plans to provide additional enforcement discretion beyond July 20. However, with that being said, we still have the FTA emergency relief docket that remains open for petitions. And I think as systems, if there's systems that have concerns, that is still an avenue available for them to petition for regulatory relief. But at this time, we are tracking systems seem to be 92% of the applicable systems are currently in compliance, and we're working hard and diligently to make sure that that last 8% make it past the finish line.
Great. It's good to hear that people are getting the job done. So a final question from MTAP's Vice Chair, Virginia DRPT's Jennifer DeBrule. Jennifer asks, how can state DOTs support expedient obligation and expenditure of CARES Act, CRISA, and ARPA funds?
I have to say hi to Jennifer again. These are all my friends asking questions. So hi, Jennifer. I hope things are going well in Virginia. So I would encourage states to work with their subrecipients, because we do know that there are some systems that the resources they receive vastly outnumber the amount of resources that they typically or traditionally receive. We also know that these are precious resources because they're 100% federal dollars, and that systems are being very deliberate in terms of how they spend or plan out how to spend those resources. So I think what we would say is that I would encourage states to work with their subrecipients to develop plans to ensure that FTA funds are obligated as quickly as possible. So let's get those grants in to show that there are needs. And we do understand that it may take some rural operators or smaller systems longer to spend the relief funding. I think the key is to develop a plan for the use of the resources and to communicate that plan to local stakeholders to ensure that all parties can move forward collectively to ensure that the resources that you all have advanced and advocated for are utilized to provide the needed service to local communities. So I think communities should be deliberate about the planning out the use of those resources and make sure that they're as transparent as possible with what their intent are for the resources, so that locally we don't begin to see there be an outcry when they think that funds aren't being utilized, when really what we've done is really been deliberate and planned out how we will utilize it. So I think systems should put some thought around the timeline and how they plan to spend those dollars, and states should make sure that you're working with your subrecipients to understand their plans for those resources.
Okay, well, thank you again, Henrika, for taking the time to talk with us. I am a former city and county planning director, so it's great to see an urban and regional planner, another one gainfully employed and in a position and in a position of leadership. We greatly appreciate your involvement with the Council on Public Transportation and MTAP and your leadership at FTA. I know you have a busy day. Thank you for taking the time to spend some time with us.
Well, thank you. And it was, again, a pleasure to spend some time with the states. I always feel like when I get an opportunity to visit with the states that it's like coming home. So thank you all. And again, if there's anything we could do at FTA, you know how to reach out to your regional administrator, and many of you know how to reach out to me. So I wish you all well, and everybody, let's stay safe.
Great, thank you. Okay. Now let's get into today's panel. You're going to hear from two state DOTs that are leading on this issue and providing critical coordination on COVID-19 vaccinations, both getting vaccinations to underserved communities using transit and getting people to vaccine sites. First, we have Lisa Radens for the Minnesota DOT and Emily Smoke with the Minnesota Department of Health, and we'll hear about the Greater Minnesota Mobile Vaccination Clinic. So Lisa and Emily, please turn on your microphones and camera, and the floor is yours.
Thank you, Roger. And thank you, everybody, for coming to the webinar today. Emily and I are both pleased to be here. We are jointly working in a pretty innovative group, collaborative group here in Minnesota to try to provide access and equity in vaccination across Minnesota. And so we're going to give you an update and an introduction to how we got started in this and where we're at today with this. So I'm going to begin. I am the principal transit planner with the Minnesota Department of Transportation, and our jurisdiction is the Greater Minnesota Transit Systems, the 5307, 5311, 5310 programs. We operate and oversee these systems outside of the greater metro area of Minneapolis and St. Paul. But I'm going to talk a little bit about how this concept got started, and then Emily's going to take over midway through and talk about where it's at today. Next slide, please. So as I indicated, on the left, we have about 47 different types of transit systems in greater Minnesota. We have our small urban 5307 programs, our 5310s, we have a predominant number of 5311 programs, and we also have 5 tribal nations. And this slide on the left just indicates each of those different systems and where they're located. The white areas of the map are areas that are outside of the jurisdiction of the Minnesota Department of Transportation, because they represent the metro area or tribal nations that are working on their own. Next slide. So just like everybody else and many of you on this call, we have pivoted. Our transit systems have changed what they do during this pandemic, and it has gone from delivering people with needed access as a predominant activity for our systems to delivering services, providing meals, making sure that people have access to vital needs, and to ensure that everybody is safe. In greater Minnesota, our systems between March 20th, March 2020 and March 2021 have delivered almost 240,000 meals. They have put on 209 service delivery miles on their vehicles, and it represents about 11,626 service hours. We are tracking these things on a regular basis and are in constant communication with our systems to find out what they need, what they are looking at, what their passengers are asking for, where they're at in terms of recovery in the systems. At this point, most of our systems are approaching about 50% or greater recovery in terms of past pre-COVID levels for passenger services, but many things have changed, as have with other systems around the country. People aren't always making the same kinds of trips, and activities have changed. Access to vaccination sites is becoming another trip purpose that wasn't there pre-COVID, of course, and we are doing things quite a bit differently than we have in the past. Next slide. Just a picture of a couple of our systems in greater Minnesota. We had a major food event with a number of other community partners in the Arrowhead region of Minnesota, which is the northern Minnesota, north central area, representing about 27% of the land mass in the state of Minnesota. This transit system covers a huge number of counties and transit riders and people in the community. And they put on some massive drives to make sure there was equitable food access and other services provided. And then our Moorhead service, which adjoins the state of North Dakota, provided a number of other deliveries to other systems and to community centers and to people in need as well. Just a couple shots of many of our systems. Next slide, please. So this concept started as an idea. I was hired by the Department of Transportation last October as the principal transit planner in greater Minnesota. And in that role, I was asked to contact all of our 5311 programs to find out where they were at in the process during the recovery of COVID or during the COVID process, but also to find out what they needed and where they were at with response in implementing some of the things they had outlined in a 5-year plan that they were asked to do. And as I worked with these systems, I began to understand their coverage area, what their clients and their ridership was looking for, what they were doing during the pandemic, and how they were really unsure of what was going to happen next. They were facing driver issues. They were facing volunteer driver shortages. There was great concern about how people were going to be able to get vaccinated once vaccination efforts ramped up here in Minnesota. And from a transit planning perspective, I started thinking about this issue as not necessarily a transportation access issue to a vaccination site, because in the early days, some of those locations were very sparse across our state, but more about how we could bring vaccinations to people. In some of the instances around parts of northern Minnesota, people live 200 or more miles away from the early vaccination locations for the public. And a lot of the transit providers in those areas were unable to cross borders of their jurisdictions that they normally operate within to provide trips to those locations further away from where isolated riders might be living and where they needed to go. We were also concerned about how the disabled community and those without any other means of transportation were going to be able to get to those facilities. And the other obstacle we faced was the fact that our public transit providers in Minnesota, like all of the others around the country, were forced to reduce passenger capacities in their vehicles because of the fear of social distancing issues and also the spread of COVID. So we had a number of obstacles in our way about how we were going to be able to effectively provide transportation services in the event of mass opportunities for vaccinations in Minnesota. As I started thinking about that, I flipped the equation and thought, how can we get the vaccinations to the people instead of the people to the vaccinations? And that is when this idea for the potential of looking at a mobile transit vehicle or plan to bring vaccination to people who are in isolated areas of greater Minnesota came about. Next slide, please. So I brought this concept up through the ranks at MnDOT to my office leaders and then all the way up to the commissioner's office. At first, the reaction was kind of what you'd expect. It was like, this is not what we do. We don't take transit buses and turn them into mobile vaccination labs. My idea was that we would use a big bus, a 40-foot or larger bus. We would take some of the seats out or most of the seats. We would find a couple of ways to put little vaccination clinics within that bus, little sites, and a waiting area. But we also had accessible vehicles. We had drivers who were contained behind barriers. And we had the ability to start working with our regional transit systems in greater Minnesota to perhaps find ways to and places to deploy this mobile vaccination plan. So one of the early things we did was look at what the demographics from information from the American Community Survey said for the 5-year estimates that was done in 2016. And we started working with our partners at the Department of Health, Emily's group, to identify what would be the parameters that we would look at to target vaccination delivery to folks in greater Minnesota. And from our information and demographics, we pulled together a number of items that were things that would help us narrow down those locations. Obviously, households in poverty, households with zero vehicles or without vehicle access, English as a second language. At the time we were planning this, the vaccinations were limited to individuals 65 plus in age, so that was one of the criteria. The equity issue was very important to us. We looked at the overall proportion of non-whites within census block tracts and the concentrations of African American, Native Indigenous, Asian, and Hispanic white, both white and non-white individuals. And from that, we put an initial map together which highlighted some key areas. Next slide, please. So what you're going to see on the left map was the initial number of vaccination locations back late in fall of last year and the early part of this year that the state identified. And each of those blue markers was a location where a community vaccination location was located. And you'll see a cluster of them in the middle part of the state to the east, bordering Wisconsin. That's the metro Twin Cities area. But the rest of them were scattered about the state. And as you can tell, there are some locations in the northern part of the state, both from west to east and also the southern corners, west to east, that are pretty sparsely located, and people living in those areas were far away from an actual location or site that they could get to. On the right, what you see is our initial attempt to identify, based on the previous slides information, what the COVID vulnerability by census block groups was in Minnesota. And if you look at those side by side, you're going to see that the red color on the map on the right is a very high prevalence for the potential of not being able to access a regional location. As you move towards the light blue on the scale, those are people who had a better chance of being within a certain number of miles to get to a vaccination location or had the ability to access transit systems in greater Minnesota to take them to those locations. So some of these locations, by the way, on this map were synonymous with tribal nation lands. So a number of those early factors included tribal nation territories, which were devising their own plans for how they were going to roll out vaccination for their tribal members. And this again was an early iteration of this map and has since changed both on the left with the amount of vaccination sites for communities, but also on the right as the Department of Health continued to drill down on those factors as conditions change. Next slide. So this last map that I have is a map showing all of the truck stations and storage facilities that are secure that MnDOT operates in greater Minnesota. And why this is relevant to this discussion is we determined that if we were going to put mobile vaccination units or buses out in greater Minnesota, they would be storing vaccines, which needed to be secured. And given the harsh weather conditions in our state, especially in the outlying areas, we wanted to make sure that we had indoor storage facilities that would be capable of providing indoor storage and secure storage for big buses. And so the thought was, well, MnDOT has all of these truck stations in different locations around the state that could offer proximity storage securely to these buses. So we developed a list of these locations, and this is what this map shows. So all of these locations are within about 35, 40 miles of any potential deployment site, and a bus could be stored there overnight or for a period of time securely if that was needed in the future. And at this point, I'm going to turn the presentation over to my colleague, Emily Smoke of the Department of Health in Minnesota to talk about how we went from this concept early on to where the Department of Health is today with deploying our program.
Great, thank you, Lisa. Good morning, everyone. Thanks for the opportunity to share what we're doing in Minnesota. And thank you, Roger, for the update on Washington State. I lived in Seattle for a long time before moving to Minneapolis and still have lots of friends and families in Washington, including a dear friend who works at King County Metro. So it's always fun to hear updates. So like Lisa said, my name is Emily Smoke and I work at the Minnesota Department of Health. In my normal role, I work on transportation and public health policy. In my COVID role, I work on COVID vaccine equity and planning. So like Lisa said, I'm going to talk a little bit about how what started as a conversation between myself and my normal role colleagues at MnDOT has turned into a full-on vaccination program that the Department of Health in the state is running. So I was originally brought into, we can go to the next slide. I was originally brought into COVID response to help develop statewide strategies that could be used to help reduce barriers to vaccines for some of our hardest to reach populations. We refer to these communities as focus communities in our vaccine response. So focus communities include people of color, urban Native Americans, LGBTQI+ community members, people with disabilities and unique health needs, people who are experiencing homelessness, people who might be distrustful of healthcare systems and might feel more comfortable getting vaccinated in a trusted community space, et cetera, and people with transportation and technology barriers. Also, target populations include our seasonal and migrant workers, food processing workers, factory workers, et cetera. So I, after many conversations with Lisa and her team, was thinking, how do we operationalize this? How do we develop this into a strategy that can be used to target these community members and kind of fill gaps that are being identified. So we have developed a really unique program that is built almost entirely on partnerships. These are public, private, and interagency partnerships. And honestly, the program is only possible because of the partner commitments. I think in other situations, it would be prohibitively expensive for a health department to run these independently. So I'm going to talk really quick about what our different roles are, and then we can dive into some more details. So the health department, my team, is providing high-level state strategy, coordination, and program oversight. Our job is to make sure that this vaccination effort is aligned with the state's COVID response and vaccination efforts, including our equity efforts. We also manage all of the vaccine protocol management, ordering, et cetera. And so us having oversight was a really important piece of this. Metro Transit and the Metropolitan Council, our large transit agency in the Twin Cities Metro, they are providing the buses and managing the entire retrofit and providing staff to drive these buses. They also are managing all operating costs. We are working with Metro Transit and the Metropolitan Council, but they are working under an emergency response for this program. And so they're able to operate their buses and send their drivers throughout the state, which is really unique. The buses are being staffed entirely by Blue Cross and Blue Shield of Minnesota staff. This includes our clinical staff members, so our vaccinators, our physicians and nurses, and also our non-clinical staff members, so our staff who are providing patient intake, post-vaccine observation, and then also staff to connect people to additional public health resources when appropriate. And then additionally, we have, like Lisa said, been working with the Minnesota Department of Transportation on just general program planning, connection to local transit agencies, technical assistance and expertise in data mapping and operations. And then also we are using MnDOT facilities for safe and secure mobile unit parking throughout the state when needed. Next slide. So here are some photos of our retrofit process, and I'll talk briefly about what our timeline has looked like. So we started having these initial conversations around mobile vaccine needs at the end of January 2021, so really not too long ago, and then started vetting high-level project scope ideas with our partners in February. Started digging into what it could actually look like. And then the first week in March, we received the official green light from the governor's office to move forward with these plans. So we onboarded our small but mighty team at the health department and got to work. So we have turned around this program in the last 5.5 weeks with our pilot clinics just having started this last Monday and our community clinics starting this coming Monday. Throughout March, we worked hand in hand with Metro Transit on the bus retrofitting. We had multiple walkthroughs, including walkthroughs with our disability and accessibility experts to get that specific feedback. Also, different cultural expert groups to provide feedback on other types of accessibility needs and requirements. Our clinical staff worked really closely with the Metro Transit overhaul station staff to make sure that the nurses would be comfortable in their stations for all day vaccination operations. We, like I said, fast forward to April, our retrofit of our first 2 buses completed about 10 days ago, and we've been using those buses this week to do pilot clinics with live vaccines, vaccinating the rest of our clinical staff and preparing them for this summer. And then this coming Monday, we are deploying our first 2 buses out into the community to run community clinics. So that's really exciting. Throughout May, we will be building up our fleet to 6 buses that will be able to be deployed throughout the entire state. And then we'll have these 6 buses operating at full scale deployment throughout the rest of the summer, with ongoing discussions around gaps and needs to determine an official end date. Next slide. So a little bit about our scheduling and deployment plan. We are identifying, well, mobile units will be operating out of quote unquote hubs throughout the state. The requirements for a hub are that there is a clinic there that can receive the initial doses that are vaccine doses that are being sent to them, and then also a MnDOT truck station or headquarters station where we can safely store the bus overnight. So we have constant Twin Cities metro hub, and then also smaller cities are able to host hubs, and then hubs throughout the rural parts of the state as well. I know you all saw the map that Lisa showed earlier, and it's wonderful to be partnering with the DOT because they touch all parts of the state. The mobile units themselves will be making pre-scheduled trips to identified communities. We are identifying the communities 2 different ways. One, using state level data to identify gaps in vaccine access, and then reaching out to local communities to see if this is a tool that could be helpful or interesting to them. More to come on that later. And then the second way is community hosts or organizations can identify gaps on their own and request a mobile unit to come to them. So we wanted it to be driven by both local identifying of gaps and needs, and then also state level data that's helping to inform decision making. Next slide. So the next slide is an image of the Twin Cities metropolitan area, just to be used as an example of how we're using some of our data to help make data informed decisions on where we send these highly targeted vaccine units. The image shows vaccine uptake on the right side, first doses in the Twin Cities metro area, and then also on the left side, our social vulnerability index. The information on the right side is coming from the Minnesota Immunization Information Network. We refer to it as MIC. That is giving us constant information on geographic locations and immunization records. And then the social vulnerability index is probably something that some of you are fairly familiar with. A geographic information set of characteristics that help us identify where there are higher vulnerable communities. In addition to SVI and vaccine uptake data, we also are using a variety of demographic data and data on where other vaccine opportunities are to make these decisions. And then, like I mentioned earlier, MnDOT has been incredibly important in providing expertise on taking this data, making sense of it, and asking the right questions. Next slide. So the requirements and expectations for host sites, first and foremost, there needs to be a gap in vaccine access clearly identified. This could be a geographic gap, a gap in transportation access or technology access, a gap in just trust of the system, language gaps, accessibility gaps, et cetera. And then the gap that's been identified can't be addressed by other vaccine providers. So can't be addressed by local public health or local clinics, healthcare providers, or pharmacies. And then also we need to be able to get the bus there. So that the location that's being asked or identified needs to be able to host a 40-foot bus. Local community partners are also incredibly important to hosting these events. We are requiring that there is a community host that can help with logistics planning, community outreach, signing people up for their vaccines, and then also be on site for day of help with the clinic. Next slide. So I know you all love buses. I do too. So I wanted to make sure I included some images of the buses now and the layout of the buses. So like I mentioned earlier, we are using 40-foot standard transit buses. You can see our most recent layout of how the buses look right now. Our clinical staff worked with our Metro Transit overhaul staff to develop this. The bus is meant to be a package deal. So it shows up with all of the supplies needed to host a vaccine clinic, including the staff on board. So this bus is able to hold all of the things we need, plus 7 to 10 staff sitting socially distanced and safely on the vehicle. Some of the supplies that are on these buses include tents for outdoor staging, external ADA compliant ramps, all of our PPE and clinical supplies, data entry supplies, and then other supplies as needed. Each bus can vaccinate about 150 people per bus per day. That might seem small compared to what you're hearing about the mass vaccination sites that are vaccinating thousands of people a day, but just a reminder that this is meant to be highly targeted and supplemental, so gap filling. And then as you can see on this layout, the patients enter through the back door, get their vaccine to the right of that, and then exit through the front door. Next slide. So here are some photos from our pilot clinic. I think these were taken on Monday before we had our extra ADA ramp delivered, but they're still exciting. We ordered an extra ADA ramp to help for when the bus is unable to park flush against a curb. The buses are ADA compliant for transit vehicles, but again, we wanted to make sure that if they aren't able to park against a curb, that we're still meeting our slope requirements for ADA compliance. Some other things to note are that the buses are wrapped in our state COVID communications design. It says roll up your sleeves, Minnesota, and then on the back, it's kind of hard to see, but there's a person with a trucker hat on and kind of doing the Rosie the Riveter arm move. It's meant to send a message of safety and legitimacy, but also provide something that's exciting and uplifting, that we're all in this together and working towards the end of this pandemic. Additionally, the bus wrap provides privacy from the outside for people who are getting vaccinated. And then as you can see on the right side of this slide, kind of a quick snapshot of what it looks like from the back of the bus looking forward inside the clinic. I was standing near where the storage bins were, and looking ahead, you can see the 2 vaccination stations with the privacy curtains that can be used when needed. Next slide. I think, oh, yes, and that's all I have. My contact information is on the screen. Feel free to jot it down, and I know that Lisa and I will both be happy to take any questions.
Great. Thank you, Lisa and Emily, for a great presentation. We're going to take questions for Lisa and Emily after both of the panels. So what we're going to do now is, I think we have a panel of 1, correct, Joachim? Yeah. So Joachim Bean with the Ohio Department of Transportation is going to talk about how Ohio's mobility management program and its program managers are successfully coordinating transit access to vaccination sites. So please turn on your microphone and your camera, and the floor is yours.
Alrighty, so welcome. Thank you everyone for coming. My name is Joachim Bean. My official title is the Data Program Coordinator for the Ohio Department of Transportation Office of Transit. So I do a variety of things in regards to coordinating programs, information, funding, that sort of thing. So one of the things that I've been working on quite a bit over the past year, as I'm sure everyone has, is the COVID pandemic. The issues regarding that, transit access, transit service, essential transportation, that sort of thing. So next slide. So a little bit about transportation, public transit in Ohio. In calendar year 2019, we had 93 million trips. We have 69 public transit systems within the state, 26 urban and 36 rural systems. So we have a variety of urban and rural systems throughout the state. And really the backbone of our COVID response, both to testing, essential transportation, and vaccine transportation, has been our mobility managers. So currently in Ohio, we have 39 mobility managers and 14 mobility management regions. Those mobility managers generally cover a county or a group of, a couple of adjacent counties as well. And those people, what's good about that is that they're based in a variety of different organizations, from MPOs to health departments, sometimes to community service organizations. And what their job is to coordinate with, human service organizations, members of the general public, other organizations that need have unfit needs met to transportation. So they are, they specialize in linking people not only to public transit, but also specialized transportation, non-emergency medical transportation, all the different types of transportation resources that may be available in that particular county. I'll get into more of that in a little bit as far as how we collect that information and how we distribute that information. But in addition, obviously, we have over 15310 specialized transportation programs funded by ODOT. Those are generally just in rural and small urban areas. In Ohio, as I pointed out earlier, we have several large urban areas with their own MPOs and that sort of thing that manage a lot of the responsibilities as far as transportation and programming during the COVID time and for the vaccination in-house. But as ODOT, we are a partner to those urban systems and providing them with any resources, transportation, funding, etc., that they may need, throughout the state through our emergency management agency, health department, and beyond. So we, try to act as a liaison as well to those urban systems. So we have a good mix of different sorts of scenarios that we have in Ohio. Next slide. So as I mentioned, ODOT funds a statewide mobility management program. Our mobility managers fund planning, coordination, staffing, and programming for transportation programs throughout the state, both urban and rural. So we're working with a lot of different populations from the Appalachian region in Ohio that has their own very unique set of needs, from our urban areas, Cleveland, Columbus, Cincinnati, that also have a very unique set of needs. So, and we have other, rural farming communities throughout the state as well. So these mobility managers are critical in that and making sure that the particular needs of and the particular conditions in that particular county are being met, and that ODOT can direct resources and can provide assistance to those particular areas, to those particular groups. Us as the state DOT, sometimes we take a sort of statewide look at things, but our mobility managers are crucial in providing the sort of view on the ground, from a county local level. And, it's really beneficial for us to have that direct line of communication between the local and state. So, you know, we can help each other as far as, you know, our resources are shared and getting, you know, vaccination and testing and that sort of thing out there. So next slide. So as you can see, this is a map of our mobility regions and managers throughout the state. As we have 14 regions, so our state is split up. We have 88 counties in our state, so each region has about 6 or 7 counties within it that are delegated to a variety of mobility managers. Some counties do not have mobility managers. So we are working with other staff in those counties, from the health department to transit agencies to human service organizations, to ensure that our resources as far as vaccine distribution are able to be executed. Next slide. So I would say the big piece of our coordination efforts as far as, you know, between health and that sort of thing, go through the Ohio EMA, that's the Emergency Management Agency. They operate a statewide operations center that was activated early in the COVID pandemic, I believe, when the first positive case was detected in the state. And that center brings in, you know, people from different agencies, from health, from natural resources to transportation to aging, developmental disabilities, mental health. All those different people come together in one. There's a statewide emergency operations center, but obviously a lot of that during the pandemic has been virtual. So before the pandemic, you know, we already had working groups together of different people as far as planning goes for a pandemic. So we were able to get those into motion pretty quickly once COVID cases started to be detected in the state. So that was very, very beneficial as far as, you know, getting our programming rolled out. And the way that ODOT work with this coordination, we work with our mobility managers, as I talked about earlier, and other stakeholders, transit agencies, you know, contractors, etc., to provide Ohio EMA with information on public transit resources, including, you know, transit routes, service hours, capacity, you know, number of vehicles, staffing in transit agencies, that sort of thing. So as the Ohio EMA was planning mass testing sites and mass vaccination sites, they were able to use our information regarding transit to ensure a more complete and equitable and more successful response, which we'll get into a little bit more on the next slide. So this was created in conjunction with Ohio EMA. We have a social vulnerability dashboard that was created. So when local health departments or the state health department or other entities are planning vaccine distribution or planning, you know, sites where vaccines are distributed, they have sort of a bird's eye view of you know, where the issues are in the county as far as the CDC Social Vulnerability Index, as you see on the right with the colored shading, where local health departments are located, the contacts for the area agencies and aging, which was important earlier on to ensure that seniors were able to get the vaccine. And you can see the Federal Qualified Health Center. Those are in purple. So those, we rely a lot on those as well, as far as making sure that vaccines are able to get to locations that are more needing of it. Again, indicated by the Social Vulnerability Index. We also have our mobility managers indicated. So as you can see in the top right is a county by county selection of this dashboard. So whoever is, looking at this can go to a different county and see, what those resources are. The red diamonds, those indicate just general providers, so pharmacies, grocery stores, that sort of thing, that have vaccines. That's able to be displayed on this dashboard as well. And finally, for our urban areas, we included our fixed routes for public transit within this dashboard as well. This is a more rural area, so that is not showing up on this particular image, but we have included that as well. So when vaccine sites or vaccine distribution is being planned, those people doing that can have an idea of where public transit routes are, so those vaccines can get to people who rely on public transit a little bit closer. And a bit on our vaccine distribution, we have 15 mass vaccination sites throughout the state. 10 are sort of fixed in place. Those are located in the larger urban areas. So, the big cities, Cleveland, Columbus, Cincinnati, Dayton, etc. And we have five mobile vaccination sites. Those mobile vaccination sites are generally fixed in place, like in a fairgrounds, a county fairgrounds, that sort of thing. And those change again based on vaccine levels and where social vulnerability is, and where vaccine rates may not be as high as they could be. So next slide. Another part of the piece that we worked on as far as making sure that people have access to healthcare, trips, transportation, vaccines, etc., is our Go Ohio Mobility Project. So during and after Ohio stay-at-home order, ODOT asked all 1,800 plus providers of human service transportation for operating status, capacity, and service details like hours of operations and willingness to deliver food and medications. So if someone was, previously may have relied on someone else to give them transportation to like the grocery store or medical appointments and that sort of thing, and were unable to do that because of the stay-at-home orders or COVID infections or that sort of thing, ODOT, we created a GIS-based search tool for mobility managers, caregivers, and the public to connect people with transportation resources. So people, mainly mobility managers using this, if someone called or contacted a mobility manager asking them if they needed a particular transportation resource, they were able to search to see the current operating status of that particular human service transportation provider, whether it was, a county health department, a public transit provider, that sort of thing, to see if they were operating and to connect them to where they needed to go as far as distance or delivery or, willingness to transport to medical appointment, that sort of thing. ODOT is integrating this effort with the Go Ohio Commute tool that WARPC and NOACA MPOs used in their jurisdictions previously. So beyond the pandemic, we will continue to be able to use these efforts for mobility managers to assist the public in connecting them to different resources. Next slide. So initially, this is what we put together during the pandemic, especially during the stay-at-home order. Another ArcGIS dashboard, as you can see in the top right, someone would select a county, and then on the top left, they were able to see a list of transportation service providers in that particular county. They were able to click on those, locate those to where they were in the county, have contact information, see information about, when those providers were able to operate, you know, whether they're willing to deliver things cross county lines, that sort of thing. And then on the bottom right of this dashboard, we had the mobility manager contact information as well. And the colors of what you see on the map of the different operating statuses of the public transit agencies throughout the state, whether they're operating in full capacity or limited capacity. So that we also use that to assist on, you know, where the needs were as far as transportation other than public transit that may have been needed throughout the state. Next slide. So this is more of the final product that we will be rolling out for Go Ohio Mobility Trip Search. This is expected to launch within the next month, so we will still be using this as far as you know, vaccine rollout and whatever else pandemic related may need to be taken care of. So, you know, you can enter in date, time, region, transportation needs, accommodation needs, ways to pay, type of service, etc. For the public and mobility managers to connect individuals to, you know, different transportation providers and rides to where they may need to go. Next slide. So you can see, you know, this is if you were searching a particular place. Let's say you were going to Berea and you need a door-to-door transportation needs. This displays a variety of providers that may be able to provide that type of transportation that you're looking for. As you can see, we have like city senior transportation, county transportation providers, Department of Aging, you know, private 5310 providers. So we wanted to, you know, take all of the above approach as far as being able to connect the available transportation resources to the public. Next slide. And that's like a pop-up window of what you would see, you know, if you were clicking for more information about that particular provider. Next. And finally, our Rides to Community Immunity program, which provides $7 million in general revenue funds that's distributed through all 88 counties throughout the state. This provides fare reimbursement, route service, mobile clinic transportation, and other vaccine-related transportation needs. So how this worked is it was an allocation based on the percentage of population in that particular county. So counties generally going to transit agencies, but in counties without public transit, is distributed to the health department to use for these purposes. Transit agencies have used this for in a variety of ways, from days offering free fares for the public to go and get vaccines. Most of our transit agencies are providing free transportation to vaccines on fixed routes and demand response service, both in urban and rural areas, and assistance with mobile clinic transportation. So using transportation resources like buses, park and ride lots, that sort of thing, to distribute vaccines within a particular place to a targeted population. Again, this is where mobility managers come in. They assist the public and organizations in scheduling the expanded transportation options. So they are working with ODOT, and ODOT is working with them and the local transit providers and health departments to ensure that they're able to access and use these funds to roll out the vaccine to as many people as possible in the most equitable way that it can be done. So I think that's the last slide. There's my contact information is on the right. Chuck Dyer, our office administrator, his contact information is on the left. So that you can reach out to me. And this presentation as well has links to those particular programs, and those links will be shared if you want to look at some of these things yourself. So
Great. Thank you, sir. Appreciate the
Yep.
presentation. Now we have a few minutes left for Q&A and discussion. And to facilitate that, I'm going to ask my colleague at Washington State DOT and our MTAP chair, Don Shardock, to facilitate Q&A. So please take it away, Don.
Sure, absolutely. People can raise their hands. They can put stuff in the chat. And Richard, maybe you can help me look out for those raised hands if they happen, where stuff comes in through the chat. I have some questions to start us off with, though. And both of the efforts that both states talked about would involve partnerships, working with local folks, whether it be mobility managers, or in the case of Minnesota, working with the local transits or emergency managers to do this work. I'd like to hear a little bit more about the efforts that went into place to make those partnerships work.
Hi, this is Emily from the Department of Health. I'm happy to jump right in and talk about our partnerships, because we are partnering with so many partners for our project: local public health, local emergency managers, local transit providers, state transportation department, private organizations, etc. I think the thing that has led us to successful partnerships right now is really being clear in communication and trusting our partners. And we are moving at the speed of lightning for a government agency, and that's new in some ways to a lot of us. And I think, yeah, really just having trust in our partners has been key to making this all work.
Was there any hesitancy on your partners' parts to say, state, what are you doing? Stay out of our business? And if there was, how did you work around that?
Honestly, I think because this is an equity strategy, people really saw the importance and need, and were just willing to do what needed to be done to make it work. We have not experienced much in terms of barriers from partners or hesitancy from partners, which has been, a really good sign of the type of people who are working on these things. Lisa, do you want to jump in?
Yeah, I just wanted to add that I think we are very lucky in Minnesota that we have a governor who really leads our state with this kind of model of collaboration and work within the agencies. And I mean, honestly, I can tell you, when I first brought it up to my superiors as an idea, they called me crazy. They thought it was a crazy idea. In fact, they thought about, who did we hire for a transit planner that they're coming up with this kind of concept? And it took a while to get up to the top of our agency at MnDOT, but then MDH, Emily's organization, they looked at it right away as an opportunity. And between their work and then going back to my agency, and then the governor finally giving his blessing, it actually fit well within what the governor was trying to do. Only we didn't know it when we first started. I mean, I again thought it was an access issue. How do you quickly get the vaccine to the most people you can in greater Minnesota versus it being an equity issue? And once you start looking at it from equity perspective and from, trying to race through a pandemic and get shots in people's arms, I think everybody jumped on board, Emily. Blue Cross Blue Shield, all the partners just said, yeah, let's do it. We got to get this done. And our governor has really been thoughtful about that, and so has his cabinet.
That's awesome.
And I think on the Ohio side of things, again, I want to give a shout out to our mobility managers. Since we had, that program already in place for a couple years before COVID-19 really hit, those mobility managers are experts in working with the different agencies, both locally and statewide as far as things like Medicaid transportation, job and family service transportation, other human service transportation needs. I think those mobility managers was really what, took our efforts and really were the ones that executed them. So I think that was how, we were able to roll all this out and coordinate all this. So.
Great. Hey, Richard, I don't want to hog the questions, but I haven't seen any others come up yet. Are there any?
There was one. It's from, let's see.
Just reminding everybody, we have about 3 minutes.
Mike Spandafor, I hope I said that right. How does Ohio fund their mobility managers? Is there a local match requirement or is the state fund at 100%?
Good, Mike. That was one of my questions too. So go ahead.
Oh, okay. Generally, we're using 5310 funding for that, which is 80/20. There are some instances where the state comes in and kicks in if there's a particular program that they are trying to provide, that sort of thing. But generally, it's federal and local, and federal local match, and there's some state funds that do come in from time to time. So that is how we're funding.
And the same question for Minnesota. What you described seemed like a lot of work. What bucket of money did you use to help support? And I'm mainly asking Lisa because she's the DOT person.
Well, actually, Emily's the one who has more info on that, but I can tell you that from a technical assistance perspective, we are just using our own time at MnDOT as staff people. We've been granted time at MnDOT to help with technical assistance, but Emily's the one who had to work with Metro Transit and the regional partners for the buses. So I'll let her speak to that.
Right.
Yeah, so like I said earlier, this program would not be possible without our partnerships. We are receiving almost everything in kind from partners. So all of the staffing, obviously money has to come from somewhere. When it comes to the other public agencies, we are relying on a lot of FEMA reimbursements for emergency response right now. And I know that that's the route that Metro Transit and the Metropolitan Council have been taking. And then internally at the health department using FEMA funds and that sort of thing.
Got it.
Yep.
We're coming right up against the hour, but I do have one more question, which is how fast were you able to get those bus retrofits done?
The first 2 buses took probably 2 to 3 weeks. And the next buses, now that we have everything down, are taking like less than 10 days.
That's really impressive.
Yeah.
All right.
Well, thank you, everybody. We've got about 30 seconds left, so it's just enough time for me to say thank you to the presenters. Great stuff happening in both states. Thank you to the FTA. Thank you, Richard, for organizing all of this, and Don for playing your part in this. And my thanks to everyone who participated, and have a great rest of your week.